Hello, my name is Chantel Lacey, and I am going to be demonstrating how to inject insulin into a patient. To set up the scenario, I'm still dealing with my patient Brian, who was here, has been here for 4 weeks. He got an ostomy appliance applied about 4 weeks ago, and he's tolerating it well. It healed up properly. He then had to be put on low oxygen, about 2 liters, which he is still continued on that. He developed an asymptomatic cough, which I delivered an anti-tussive suppressant medication to him, which was last week. And this week, due to all of his medications, like the pain medications that he got from from having the ostomy put in, and sort of kind of low stress levels, his glucose level has been elevated, a little elevated for this past week. He has not been over 200, but he's just been at 200. So today we're going to administer him a little insulin per doctor's orders. So I'm going to go into the patient's, sorry, I'm not going into the patient's room. I'm going into the med room, the supply room. And I'm going to check the order against the MAR in the drug picks room. I'm checking it against the patient's name, the right dose, the right drug, the right route, and the MRN number to make sure I got the right patient. So I'm going to pull the I'm going to pull the medicine out the Pyxis. That's my first check that I'm doing. The 3 checks before I administer this medication, that's the first check that I'm doing. So the medication matches up. I'm going to lock the supply Pyxis. Now I'm going to go enter Brian's room. Brian, I'm going to his room. I have all the necessary supplies that I need to perform this administration. As I go into the room, I explain to Brian why I'm here. I also then do my second check of the order while I'm in the room. I check for the right medication. I check all the label dose, the expiration date on the medication, right patient, right route, which is going to be just 5 units of insulin. I'm doing this to make sure that he get his medicine on time. And I am going to then check his, ask him to state his name, date of birth, and I'm going to check his MRN number. All that matches up for my second check. My third check is then I'm going to scan the medication, scan the barcode on his armband. I'm going to also check his MRN number against the MRN number in the MAR. I'm going to check his name and date of birth also against the MRN record. And I am going to ask him if he have any allergies that he know of, and then I'm going to check in the chart to make sure there is any known allergies that he might not know of. So I have the right patient, all that is done. I'm going to perform hand hygiene. I'm going to explain to him what the insulin is for. It's to help bring down his blood sugar levels in his blood because he has been over 200 after every meal. So we're going to discuss the location of site that he wants the injection. He can get it in the abdomen, the arm, the thighs, the lateral side of the thighs, below the shoulder blades if it's an adequate enough fat, and then the glutes or the side of the hips. So he picks the dorsal portion of his upper arm, and I'm going to assist the patient in a comfortable position. I'm going to let him know what I'm doing every step of the way. So I'm going to clean the site in his on the side of his arm. And I'm going to clean the site. I'm going to demonstrate using this orange. So the orange is going to be his arm. I am a diabetic, so I have a pre-filled insulin needle pen, and I'm going to use that to demonstrate the administration of the medication, which his order does have a pre-filled insulin syringe. And they come with these disposable or, needles that you can attach to the pen. And I have an alcohol pad. I will have two because I will have to scrub the hub of the insulin pen before I attach the needle. And I'm going to also have to scrub his injection site using a firm circular motion, working my way out away from the circular motion out away from the injection site. So I'm not going to open all this because I only have one. So I will clean the hub. You would take the cap off, and this is what it looks like. I would take this alcohol pad if it was open, and I would scrub the hub in a circular motion. I will let this dry. I will attach this needle, which opens, and it has a cap, and then it has a protective cap and then a protective needle shield. So I will screw this attachment on. And then this is attached and screwed on, it puncture it. I would then dial up 5 units of insulin on my insulin pen. Recap this with the needle attached. And now I'm going to let him know that I'm going to grab the back of his arm or the side of his arm, and I'm going to squeeze it, get a firm grip on it with my non-dominant hand. I'm going to scrub from the inside outwards in a circular motion. I'm going to allow that to dry for 15 to 30 seconds. I'm going to take my pre-filled syringe, and it has the needle attached, which will be this. It's attached. I'm going to go in. I have I'm pinching the skin up where there's adequate fat, and I'm going to go straight in at a 90-degree angle, letting him know when I'm going to do it. It is going to be a little pinch. I'm not going to lie to the patient, say it doesn't hurt. It's a little pinch. I go straight in at a 90-degree angle. I release the skin, steady my needle with my non-dominant hand. Once I release the skin, I go straight in, and then I'm going to, with my dominant hand, press in the dosage of the insulin very slow. And we do this in decompressed skin so that it doesn't hurt the patient or get absorbed too quickly. So I decompress the needle, let the insulin go into the patient, into the arm, into the injection site. I pull out quickly so that I don't interrupt the skin integrity. And then I do not recap. This needle has a purple tip, a needle protection, and then this is the protective cap. So I will not recap the needle, but I can put this protective coating back over top of the needle, unscrew it from the pre-filled syringe, and dispose of this into the appropriate disposable recyclable, which is the the Sharps container. I will clean this off again, re-put it in, recap this, and I will take this back to the Pyxis, to the patient's Pyxis. Once I'm done getting him situated, I will take this back to put this back in his Med Pyxis. Once I'm done, I will apply pressure to the injection site for 60 seconds, and then I will release. I will reposition the patient, have him back into a comfortable position. I will ask him, ask him if he have any questions about about the medication that he just received. I will assess his injection site. Brian is aware that he's on insulin because he knows of his blood sugar levels have been a little high since his stay here from the surgeries, pain medication, the stress he's under. It's a lot of different things that can cause someone's blood sugars to be out of whack. Once I done administering his insulin medication, I going to document my actions that were taken with the drug administration. I would document the patient's reaction to receiving the drug administration. If he had any concerns, I would document the skin integrity before and after, and I will reassess my patient 2 hours after his insulin administration to check to see if his blood glucose level has went down since his insulin administration. And I can also have delegate that to the nurse's aide to check for me, depending on the facility that you work at. And by this being his like 3rd time receiving it, I can delegate that to the nurse's aide. I'm fine with doing that. And then I will come back in once I get his assessment 2 hours later, the results of the glucose test or blood test. I would then go back in and let him know that his blood sugar did go down. The aide probably would tell him too, because sometimes they ask. And then I would assess if he needed anything to drink, snacks, any new orders that were put in. So I perform hand hygiene as I'm exiting the room. And while I'm putting this back in the med pyxis, I perform hand hygiene while I'm exiting the room. Let my patient know I'm here for him, make sure his call light is in reach, and let him know that he will be being discharged by the end of next week, hopefully without any more concerns. So I thank you for your time on this weekly content of administration of and medication per a alternate route. And this was dubbed, this medication is administered subcutaneous into the adipose tissue of the fat, into the patient, I'm sorry, the adipose tissue of the patient. The gauge on this needle, I forgot to mention, is a 31 gauge. So that is a very, very tiny needle. It's an insulin needle. So it's very little pain with that. It is a little discomfort when you first do it at the injection site because it feels like a little pinch, but then it goes away. You are not supposed to rub the site once after you administer the medication. You just apply pressure and release. Do not rub because it can cause the medication to move elsewhere that you unplanned for in the injection site. And we want that to be very absorbed. In the arm, it is absorbed very slowly in the body. If you inject it in the abdomen, that's the most quickest route of absorption of a medication subcutaneous. And with that being said, this is my weekly content of the skills that was done, and I look forward to speaking with you next week. Thank you. Have a good day.